It's estimated that 1 million Nevadans suffer from diabetes or are pre-diabetic, while costs of medications continue to rise.
Today, 2 Democratic senators met with those suffering from the disease for diabetes Day at the legislature. Liz Elveda joins us now live with a look at what a Senate bill proposal would do to keep insulin costs low. Elizabeth?
That's right, Landon. Insulin costs have risen almost 400% between 2006 and 2013 alone. Today, Senate Majority Leader Aaron Ford and Senator Ivana Cancela hosted a press conference to hear from Nevadans all across the state who are affected by this disease and to discuss the introduction of Senate Bill 265.
12% of all Nevadans have diabetes, 38% are pre-diabetic, and we are on track to double our diabetic population by the year 2030. To me, that's a public health crisis.
Now, SB 265 would address both insulin price increases and transparency. The bill would establish certain insulin-related medicines to be treated as essential for patient survival. It would also create a refund when insulin costs exceed the Medical Consumer Price Index. Hospitals would be required to report their billed charges and profits through quarterly reports, while health plans have to report and prove they don't make more than a 20% profit. It would also require information from the drug makers themselves, from how prices are set, the cost of the meds, and the amount spent on research. Cancela tells us the only public opposition to this bill so far is from the pharmaceutical industry, and patients are pleading with them to listen.
I know I'm not the only person that's suffering. I'm just not scared to tell my story because I really want some help. My son's 11. I would love to see my son graduate from high school.
Now, the next steps for this bill are to add some amendments before being heard before the Senate floor, and if passed there, it would then go on to the Assembly. Covering the story live, Elizabeth Olveda, Channel 2 News.